histopathological findings in brain tissue obtained during epilepsy surgery. Definition: surgical resection represents a successful strategy to achieve seizure control in patients with drug-resistant epilepsy. A broad series of lesions can be observed in these patients, including hippocampal sclerosis, focal cortical dysplasias, long-term epilepsy-associated tumors, vascular malformations, liver scars, perinatal infarcts, or any other ischemic insult, inflammations, or an association of these pathologies. Medical applications. A standardized neuropathologic examination of brain tissue obtained from epilepsy surgery allows the correct classification of the clinical pathologic substrate of the epilepsy disorder and contributes to predict the patient's risk for unfavorable post-surgical seizure control. Pros and cons. Pros. The described methodological approach aims to relate the surgical outcome to the specific pathological findings, the sites of the lesion, and the surgical strategy. These data are essential to an adequate preoperative patient and family counseling. In this paper, besides the workup and the classification systems, we have evidence some aspects which may be challenging and sometimes misleading in clinical practice. Cons. A current comprehensive epilepsy surgery program should include non-invasive and invasive anatomo-electroclinical advanced imaging study and a well-established neuropathological assessment protocol. In these settings, our suggestions might contribute to focus some specific issues needing a further deeper definition for a better management of the epileptic patients. Issue applied in Ecuador. A large-scale neuroepidemiological study was carried out in a population of 72,105 inhabitants of the region of North Ecuadorian Andean Sierra to identify prevalence and incidence rate of epileptic seizures and to identify demographic and geographic variations in these rates. First, rates were calculated from all cases identified in the field. Secondly, lower rates were calculated based on a further diagnostic and reclassification procedure. Thirdly, higher rates were derived by calculating false negative rates from the screening procedures and adding these to the case actually identified. Conclusions. In patients with drug-resistant focal epilepsy requiring surgery, hippocampal sclerosis was the most common histopathological diagnostic among adults, and focal cortical dysplasia was the most common diagnostic among the children. Tumors were the second most common lesion in both groups. Thank you.